Hi guys, welcome to Module 3 discussion post. Today I will be performing a 7-site Skinfold test on my client. The 7-site Skinfold test measures body fat percentage, particularly subcutaneous fat. In most people, in a lot of people, about 1/3 of their body fat is subcutaneous because we do have fat in other parts of our bodies, like internally around our organs, visceral fat. This test is used by using a skin caliper tool. This part is going to be used to pinch different areas on your body, and it is measured in millimeter thickness. And then when you are done measuring all different 7 sites, you will take all those measurements and plug them into an equation. However, before you begin this test, it is important to make sure you get the A-OK from your client, that they are comfortable and that they know exactly how the test is ran and where you are performing these measurements. If they are not comfortable with all 7 sites, there are 2 other different equations. There's a 7-site equation, and then there are 2 3-site equations. Make sure that informed consent is all okay, and then, you can start the test. Okay, first we're gonna start with the chest measurement. It's gonna be between the armpit and the nipple line for men. So this is gonna be a diagonal pinch fold. You're gonna pinch the skin, pull it away, and measure it for about 1 to 2 seconds. I will also be measuring each skin fold site twice for maximum accuracy. Okay, the next site we're gonna move on to is the abdominal area. So we will find the belly button and move 1 to 2 centimeters to the right. Also, I forgot to mention, we will be performing all of this on the right side of the body, and my client will be standing upright and straight the entire time. So for this one, I will be doing a vertical pinch. Okay, the next skin fold site that I will be doing is the suprailiac. So I will be palpating the top of his hip bone, and then I will be moving about 1 to 2 inches up and grabbing it diagonally, and then pinching. The next site that I'm going to be measuring is the thigh. So you're going to be finding the inguinal crease. It's going to be this V line right here that you'll see on every individual. So it's going to be right here. We're going to start there about, and then we're going to find the medial part of his patella, and we're going to find the midway point. So I kind of used like my thumb to thumb, so it was about right here. And I'm going to be performing a vertical fold. The last one on the front of the body is called the mid-axillary. So we'll be finding the xiphoid process. It's a really bony circular structure right here that you can palpate. And then we'll be moving all the way across, right underneath his mid-axillary line, under his armpit. And this one is also going to be a vertical fold. This one's kind of a little uncomfortable to perform, but okay, and now I will tell you to turn around. We will do the triceps measurement and the subscapular measurement. The subscapular, in order to find the area that you're going to measure, it helps if you place their hand behind their back, and then you can see where their shoulder blade is. And then you can see the inferior line pretty well. And then you measure about 1 to 2 inches out, and then this is going to be a diagonal pinch. So you will be grabbing it diagonally. The last measurement site is going to be the triceps. So you'll find the acromion process, which is going to be this pointy ball-like structure right here. and then the olecranon process, which is going to be the pointy part on your elbow. So you will find the top of the acromion and the olecranon and like a midway point. I'm going to be using my thumbs again here. And this one is going to be a vertical fold. So that is all 7 sites of the test completed. Make sure you duplicate each site twice in order to ensure maximum accuracy. And then you're going to be taking all 7 measurements and plugging them into either the 7 equation formula, or there are 2 different 3 equation formulas.